So good afternoon, Mpala.
Good afternoon.
We have just come to the end of a 3 days training within the project Enhancing Participatory Democracy that had invited representatives of civil society networks in order to discuss about how to become a more credible organization when it comes to engaging within what we call the policy cycle. Could you, from your perspective, you have a long experience as a trainer, could you first of all introduce yourself and then tell us a little bit what does it take to actually become a credible organization to engage within the policy cycle?
Thank you very much, Christine. My name is Mpala Nkonkomalimba and I flew in from Zambia. That's my home base, and I do a lot of work. It's been over 25 years of supporting civil society, not just in Zambia. I've done some work in Nigeria as well as in Kenya and in Zimbabwe. Your question is interesting in the sense that I think we really do rely on civil society as a part of society that is supposed to help us ensure that human rights are being respected by the state and that we actually are getting policies and programs that are put in place respectful of human rights. So if you want an organization to be able to engage successfully in policy engagement, some of the areas that I think would have to be very important to look into would be the capacity of this organization to actually understand the policy cycle and what the different stages are.
Okay.
It's also about the civil society organization being able to identify who the decision makers are and also being able to identify how to engage with them and when. The timing is always important.
Okay.
It's also about getting a civil society organization that knows who their constituents are, who is it that they're serving, and being able to engage them in the whole process so that they speak on behalf of, but also speak sometimes with the people themselves. The organizations also, to be credible and to be able to be successful, need to also be able to produce evidence.
Yeah, of course, yes.
Evidence that they can then use in advocacy. And the evidence has to be timely, it has to be relevant, it has to be valid, because the last thing that you want is a decision maker asking, of what relevance is this data that you've shown me now to my work?
Yes.
Right? They have to be able to also offer alternatives. If something is not working, civil society ideally should be able to document and show government any alternative way in which something can actually be done.
So they need to be innovative too.
They need to be very innovative, very creative. And of course they also need to be networking. If you want to be heard, it's about building that critical mass of people that's all going to be saying the same thing. And so the decision makers get to understand that this is not one lone network or one lone organization saying one thing, but that they're backed by a lot of people all wanting some level of change.
And would you perhaps have an example for us?
An example based here in Namibia?
Yeah, or in Zambia?
Okay, I think I can give an example of, for instance, the need to have a disability policy back home in Zambia.
Okay.
Right? What had actually happened was that an organization, civil society organization, reviewed all the policies in the country and understood and alerted everybody else to the fact that the language that was being used in reference to people, for instance, with mental health issues, was actually very derogatory.
Oh, wow.
They were all being called imbeciles.
Oh my God.
Exactly. And we didn't have a mental health policy. And it took civil society to raise awareness around this issue. And government actually did then put in place not just a policy, but an act as well.
And I guess government was also grateful to have some kind of new ideas and promoters and...
Absolutely, because it's not always that people shouldn't always expect that government will know what it is that's on the ground. So we had cases where, for instance, an activist came to the fore and brought forward pictures of how mental health patients were being kept in their homes. And it was very, very telling. In a workshop, people broke down because they just didn't realize how bad things were for people living in chains and this sort of thing. And this has actually improved the situation because we now have a policy in place.
Okay, wonderful, great example. Thank you so much. And do you think you would like to come back to us and work with us more?
Of course I would. I mean, in the workshop, the interaction I had with the civil society organization, it was so engaging. It was just interactive, and I think I got a sense that they would love to make a change, and it would be nice if I was able to support them in any way I can.
Oh, great. And did you have the example, the impression that they actually, as network representatives, will go back and teach their networks?
There's an action plan that's been developed at the end of the workshop,
Okay.
and looking through some of it, I can see that quite a number are planning to disseminate the data that they actually have from this workshop to their colleagues back in their offices. So even that is encouraging.
Okay, great. Thank you so much.
You're most welcome,
We hope you
Christine.
come back soon.
Thank you for inviting me.
Okay.
Thank you.